back to the blend. Find relief for pain. Our next guest can pinpoint the source so you can start living life fully again. Dr. Devin Lazard is back with Spinal Care of Nevada. Great having you again, sir.
Always great to be here.
So the NUCA method, explain the NUCA method to us.
Well, it's more gentle chiropractic. People are afraid sometimes of going to a chiropractor or they've had a bad experience because they don't want to get twisted, cracked, and popped. And the NUCA method is very gentle. So rather than seeing people every day the rest of their life, we have a set program that gets people better, teach you how to take care of yourself down the road so you're not reliant on a doctor.
So let's take a look. We have a video that actually shows how you're able to pinpoint the location of pain. Explain this for us.
Okay, so if you figure this brain sits at the top of our body, and most of us have one there, our spouses may argue with that, but the brain sends the nerves down the spine. The nerves come out the side, they run to every muscle, cell, and organ in your body. Bone out of place, maybe from a fall, an accident, sports, you name it. What it does is it pinches a nerve. That can cause pain, numbness, burning, tingling, weakness anywhere throughout the body. So my job is to find where in the body the bone's out of place, very gently fix it so the body can fix itself. Bone out of place, top of the neck, think headaches, migraines. Those nerves run to the sinuses, cause headache pain, sinus problems, allergies. Middle of the neck, that's thyroid, that's weight gain, sometimes too much weight loss. Nerves run down to the hands, carpal tunnel. So people get their hands cut on. A lot of times the problem comes from a misalignment in the neck.
Wow.
Here runs to the heart, the lungs. This adjustment, the NUCA Chiropractic Organization studied high blood pressure. The adjustment can lower it equal to 2 medications. And I don't claim to cure really anything, blood pressure, but when you get the pressure off the nerve for the first time in a long time, the body can fix itself. As we get towards the middle of the body, these nerves control the stomach. Now, stomach is indigestion, heartburn, ulcers. But those nerves also run to the pancreas, which is, remember, diabetes, immune function, getting sick all the time, your kids, you. Also when the body attacks itself, like rheumatoid. Wow. Here at the bottom, these nerves, small and large intestine, which is ileocecal valve, constipation, diarrhea. Messy conversation. Yeah. Okay? And again, I don't claim to cure that, but when you get the pressure off the nerve, the body can fix it. At the bottom, that's male organs, female organs, prostate, ED, menopause, painful cycles, hot flashes, and all the other joys that go along with that. Remember those nerves at the bottom? That's also sciatica, burning into the buttocks, into the knees, even bottom of the feet, which is neuropathy. And so what we have is a very gentle adjustment to get the pressure off of the nerves. And that way, sometimes symptoms that people have dealt with their whole life, chronic pain, nerve pain, pinching, numbness, burning, tingling, you can fix it without getting shots, without getting cut on.
And you're getting rid of essentially the traffic jam so everything's working at the best of its ability.
You have the best analogies in the world.
I do what I can. And for people that have chronic pain, I mean, I think they just figure, oh, well, I have to live with this for the rest of my life, but this is not an excuse.
Or a doctor tells them, here, take this drug, take this pill, and what happens is it might feel better for a little while until the problem gets so bad that you have to have surgery. So these days, about 10% of my practice actually comes in for maintenance. They don't really have pain. They're not really suffering. You get a signal of pain or a symptom. That's the time to come in and get looked at.
Low-level laser therapy. This is something that you utilize as well, and I know it's really healing stuff.
So there's 2 things we do very well. One is a very gentle chiropractic adjustment that gets results where other things have failed. And the second is we apply a cold or low-level laser therapy to a problem area, and the idea is you get more circulation there. So think arthritis, bad joints, shoulder, wrist, knee, hip, more circulation to that area. You don't get the joint back, but it feels better, and the decay slows down. So once again, you have quality of life, and you don't have to go get cut on or go under the knife.
So if people are feeling a pain in their neck or really anywhere else, how do they get in touch with you? How do they get this?
Remember, sometimes a pain in your neck is somebody else's pain in the neck, so that's another reason to get fixed. So here's what we do. We have a 2-day workup to see who we can help and who we can't. Listen, my main job as a doctor is to get you the help you need. So if it's not office, I'm going to refer you somewhere else. Our 2-day workup normally is $180. We're going to limit it for this show to the first 20 callers. We'll do the workup for $37, and we do cut it off at 20 callers.
All right, so make sure you get in right now. Dr. Devin, pleasure having you as always.
Always great to be here.
Thank you so much. Dr. Devin has that great special for the first 20 callers. It's a 2-day workup, which includes a discounted fee of $37 for a consult, exam, and x-rays. This is not valid for Medicare-aged patients due to federal guidelines. For more information, call the number or visit their website. Locations include Summerlin and Henderson.